And here with us now is Jacob Rich, health policy analyst at the Reason Foundation and an associate contributor at Young Voices. Jacob, thank you for being with us this evening. I think this report comes as a bit of a surprise given how tough 2020 was for so many people. How do you account for this drop in suicides?
It definitely is a surprise because halfway through the year, the Substance Abuse and Mental Health Services Administration, one of the departments under the Department of Health and Human Services, they reported that about 25% of young adults had serious thoughts of suicidal ideation. And those increases in suicidal ideation we actually saw across all age groups. The one thing we must consider, though, is that when we look at these data at the macro level and the large geographical level, like the state level, we really don't see a correlation between thoughts of suicide and actual suicide rates. At individual level, it's definitely important, but not at the geographical level. So keeping that in mind, we saw that there was actually a decrease in suicide, even though thoughts of suicide at the geographical level went up. And my hypothesis on this is pretty simple. When we look at states ranked by their suicide rates, the states that have the lowest population densities, such as Wyoming, Alaska, Idaho, they by far have the highest suicide rates, while the densest states like New Jersey and New York, where most people live in New York City, they have the lowest rates of suicide. My opinion, looking at the moving data from the USPS, with people moving and changing their addresses, I think people moved out of the states and repopulated the areas that had very sparse populations and actually reduced the risk of suicide in the states that had the highest risk of suicide previously.
So it does seem like young people have been significantly affected by COVID. Are there more suicides among young people in 2020?
That's a great question, and the JAMA report did not cover that. There was no breakdown of suicide by age. However, there were some early release data from Massachusetts, which were published in one of JAMA's sister publications, JAMA Network Open. And they showed that the suicide rate, I think through March 2020, the average age of the suicides from March 2020 compared to the same period in 2019 was the same. So with those early preliminary data, it doesn't look like the demographics of who committed suicide changed that much, but that's only one state for a limited amount of months. So we really won't know until the detailed data are published in December.
Yeah. What about unemployment insurance enhancements? Is there evidence that that contributed to a reduction in suicides?
Well, it would be hard for it to contribute to a reduction, but it could prevent an increase because after population density, unemployment is the second most predictive factor in determining a state's suicide rate. So it's not like providing more insurance would necessarily lower the suicide rate, but if there was a potential risk of suicide by people going unemployed, the Trump administration's intervention, increasing the amount of payments and the amount of money being paid, certainly softened the conundrums that come with being unemployed. It probably prevented the suicide rate from going to unprecedented levels once again.
All right, Jacob Rich, we will leave it right there, but we appreciate you taking the time to talk to us this evening and help us break down this information. Thank you.
Thanks for having me.